Okay, sorry about that. Hi, my name is Breeanna Pham, and I hope everyone is having a great day so far, wherever they are. Um, Before I begin my presentation, a little bit about myself. I am currently a junior at Arcadia High School, which is where I am also currently presenting. And I wrote my paper along with my mentor, Ollie, and in this paper, I essentially discussed how more research should be allocated towards the understanding of DID. And I got interested in this topic because from a young age, I used to watch a lot of videos with people with DID, and I was always curious about the background and the etiology of DID. So, yeah, the title of my paper was called The Mystery of Dissociative Identity Disorder, a letter to the editors, or in short, for dissociative identity disorder, DID. Great. Um, a little bit about what I will be going over in my presentation. I will go over an introduction to what DID is, the models of dissociation, the neuroanatomy of DID, the demographics of diagnosis, false positives, and my conclusion and references. So to begin with my introduction, DID is a very rare disorder that only about 2.5% of the general population have, and it is often misdiagnosed with similar presenting disorders like schizophrenia because it is typically a comorbid disorder that has that most people have other factors like um, anxiety, depression, PTSD, and etc. And with the more funding allocated towards DID, we will be more able to understand the difference between the symptoms and the brain activity between DID and other similar facing disorders like schizophrenia. To continue, the widely accepted cause of DID is repeated childhood trauma that occurred between the ages of 5 to 10, which is when it is developed. However, early symptoms will be noticeable at around 6 years of age. To continue, its validity is established through its demonstration of content, criterion, and construct validity. And additionally, symptoms of DID from the DSM-5 include episodes of amnesia, fugue, depersonalization, derealization, identity confusion, and identity alteration. Sorry. To continue, the models of dissociation include the trauma model, the fantasy model, and the socio-cognitive model, which I'll be from here on out occasionally be referencing as the SCM. To begin, the trauma model posits that dissociation occurs due to trauma, for example, but is not limited to rape and physical abuse. Um, so the way the trauma model works is that a child will be um, inflicted with a lot of abuse based off of their original caregiver. And because they do not have anyone to advocate for them and protect them from said abuse, they will eventually begin to dissociate a lot. And from this dissociation, new alters could be formed to either protect the child or to help the child maintain their childlike innocence. However, other models like the fantasy model and the socio-cognitive model tend to downplay the role trauma plays into the role of dissociation. And so this trauma and the trauma model does the same with the fantasy model and the SCM. The fantasy model posits that dissociation occurs casually and not due to trauma. And this is noticeable by researchers when they were describing to participants in a research study that they went through a trauma that they didn't actually experience. And then those participants began to recall said trauma that they never actually experienced. To continue, the socio-cognitive model proposes that cognitive predisposition, social factors, and sleep disturbances cause dissociation. However, the one area in which all of the models of dissociation do agree on is that DID is a disorder of self-discovery and self-understanding. To continue with the neuroanatomy of DID, there has been there has been noticeable significant prefrontal cortex dysfunction in 109 individuals with dissociative disorders, which was found by Modesty and al. And by significant prefrontal cortex dysfunction, I mean that there has been noticeable hyperactivity with the prefrontal cortex when in the resting state compared to the controls as well as the actors in the study who were pretending that they did have these various disorders. And to continue with this hyperactivity, it was also noticeable in the anterior cingulate gyrus, the temporal and insular cortices, and the parietal lobe. And in the graph on the right, you'll see the various people with the various disorders in this um, in this to continue with the demographics. There are great discrepancies between the rates in which assigned female and male at birth individuals are diagnosed with these various disorders. For example, within a Turkish study, among 70 individuals, only 23 males were diagnosed with DID compared to 27 females. This may be explained by the fact that many males with dissociative disorders, or DDs, and other mental illnesses are believed to be incarcerated. This number is significant because it heavily skews the data into suggesting that there are more females with DID compared to males. And while this may be the case, we will never know for sure because of this heavily skewed data. Additionally, because it is assumed that many males with dissociative disorders and other mental illnesses are incarcerated, they may never find the correct treatment so that they understand their symptoms and what is occurring within their mind. To continue, there are many instances of false positives due to the popularization of DID among social media platforms like TikTok and Instagram. And because of how easy it is to access the symptoms online, it is easy for naive clinicians to make a diagnosis with someone who is actually faking the symptoms all along. These false positives heavily skew the data regarding DID because it may tip the favor in either side. Maybe it's more men who have DID or maybe more females. However, we will never know because this heavily favors the data to one side. Additionally, within these naive clinicians, they may start to believe that DID presents in a specific way, and that may not be true because many individuals with DID tend to not exactly show the symptoms because they were taught from a very young age that they have to hide their symptoms in order to assimilate more better within their environment and their very abusive environment. In conclusion, although DID is considered a valid disorder, models like the fantasy model tend to invalidate it by disregarding the role trauma plays in for dissociation, and so does the trauma model. So within this extra funding, we could possibly gain more of an understanding how either of these models maybe contributes to it more, or how it is or how it may be a mixture of the two. Additionally, because it is believed that there are more men incarcerated than women, it feeds to the narrative that more women have DID than men. And while this may be the case, we will never know for sure because of how many men are incarcerated compared to women. And finally, people with DID may not know that they even have it because of how similarly it presents as other mental disorders like schizophrenia, and they may never get the treatment plan that they need because in a research study, it showed that before an individual got their final diagnosis of DID, they had an average of 2.3 previous diagnoses. Here are my references, and thank you for listening to my presentation, and I'll be more than happy to answer any questions.
Yeah, absolutely fantastic. Excuse me, fantastic topic. One question that came through was about the treatment options for DID. Can you talk a little bit about how, just what treatment options are available for those that have this this issue?
So I was doing research regarding this, and a lot of it, or some of it, is hypnotherapy, where like a therapist will like try to hypnotize this person, and then they would over the course of a couple sessions, they'll begin to forget that they have DID. However, that isn't really possible because it is something that is integrated from a young age. However, one that is a very common treatment plan currently is like it's like regular therapy, and they go through multiple stages of this treatment. So like I kind of forgot like the original stuff, but like it's like they initially begin with like self-discovery, and then over time it'll be to like starting to integrate the personalities and allow them to communicate more effectively so that the person isn't as unaware of what's going on of their surroundings.
Wonderful. Awesome. Thank you so much for your fantastic presentation.